Good afternoon. Come on in and be seated. We'll get started just a moment as soon as I'm given the high sign that we're ready to go. Are we ready, Mary Kay? Well, good afternoon, everyone. My name is Stephen David. I'm a member of your Indiana Supreme Court. We're going to convene the October 30th meeting of the Jail Overcrowding Task Force here in Porter County at Ivy Tech. We're very grateful for the opportunity to be here. I am the facilitator of this meeting at the request of Chief Justice Loretta Rush. She asked Justice Christopher Goff and myself. He's here, I'm here, to help with this project that was a legislative initiative. I'd like to thank, on behalf of the task force, Ivy Tech Community College, for allowing us to use this space, and for the assistance of Nicole Doctor, Criminal Justice Program Chair. So maybe we have some criminal justice students in here. Anybody a criminal justice student? Outstanding. Make sure you're taking good notes because we're going to need your input. And Kathleen Kosteka, Executive Secretary. So a round of applause for Ivy Tech and everyone. I'd like to introduce members of the task force to you. You'll be hearing from some of them today, and all may be asking questions of the presenters today. Joining us as members of the committee are the following: Representative Greg Sturwald, the co-vice chair, Indiana House District 40. Representative Reagan Hatcher, Indiana House District 3. Senator Mike Gaskill, co-chair from Indiana Senate District 26. Senator J.D. Ford from Indiana Senate District 29 is unable to be with us today. Tracy Brown, Tippecanoe County Commissioner. Douglas Huntsinger, Office of the Governor, who's down here with me on this side. Ralph Watson, Indiana Association of Community Corrections, Act Counties. Commissioner Robert Carter of the Indiana Department of Corrections. David Powell, representing the Indiana Prosecuting Attorneys Council. Bernice Corley, Indiana Public Defender Council. Sheriff Brett Clark, Hendricks County. Superintendent Doug Carter of the Indiana State Police. And Justice Christopher Goff. Thank you all for being here. And again, thank you, members of the public, for being here. The purpose of the task force, again, created by our legislature, is simple yet extremely complex. It is to conduct a statewide review of jail overcrowding, to identify common reasons for that and possible solutions, as well as to study ways to reduce recidivism for those in jail by offering programs and services. Thank you for taking time to attend today. We'll be receiving some presentations to help inform us and our mission, understand better issues related to jail overcrowding, and taking some public testimony today. So some of you may have signed up and are prepared to give public testimony. We welcome that. The task force information can be found online at the web address provided on the screen and included on the information sheet that was distributed as you entered this room. We would be remiss if we didn't take the opportunity to express our most sincere appreciation and thank you to Sheriff David Reynolds and his jail commander, Stephen Lawrence, who invited the task force this morning for a tour of the Porter County Jail. It was nothing short of a marvelous tour, exceptionally professional staff doing a tremendous job with the support of the men and women of this county, county council, county commissioners. What the sheriff and the jail commander and their team is doing for this community is again, nothing short of extraordinary. And we wanted to see how it works and how it works well. So that's why we came up early to take a tour of the jail. How can you ensure public safety of paramount importance, but at the same time, while holding individuals accountable, provide a path forward to them? And Sheriff, thank you so much. We're just very grateful to you. Before we begin testimony and our presentations today, Representative Reagan Hatcher would like to make some opening comments.
Thank you so much, Justice. As a former prosecutor in Lake County, Indiana, I have seen a number of incidents where there is a direct impact on not only the person who is arrested and goes to jail, but also those around them and their families and their own property. Take, for instance, the very basic example of a person being arrested for a driving while suspended crime. In big terms, we always think of people in jail as real criminals. And when I say real, I mean criminals who have done things to either hurt someone, take something from someone. But there are also people who sit in jail who have very small misdemeanor crimes, such as driving while suspended, maybe passing a bad check. When those persons are arrested and have to go to jail, a number of things follow that. Normally, a car may be towed, a job may be lost, kids may be put in foster care. Those things are all difficult, not only for the person who's been arrested, because normally they're arrested because they don't have the funding to either be able to not have a suspended license or to not pass a bad check, just for two examples. So I think that we have to think about the bigger picture. Who all is impacted? How much money does the state of Indiana pay to have to deal with foster care situations? And then how much money does the person who is arrested have to pay? It's not just bond or bail. It's also the towing fees or the tow yard fees or maybe fees for an attorney to deal with a DCS case. I think the goal, at least for me here, especially coming from Lake County where we see overcrowding, is that number one, all persons who are arrested are released while they wait for trial, unless it is a high felony or unless they have failed to appear in the past. Secondly, there's a direct correlation between those persons who are arrested in many cases and drugs and alcohol, either abuse or use at the time of the crime. And so we'd like to see those people as a ultimate goal get the services that they need, not in jail, but in a drug treatment or alcohol treatment facility. So as a general statement, we want to, or I would like to get to a point where jails are never overcrowded, where we can begin to close jails because they become less and less necessary because we're treating the underlying issues that cause people to commit the crimes that send them to jail. And also, I like to see on the other side of that, the opportunity for people to not be arrested for smaller misdemeanors. So I have some real ambitious goals, and I'm sure everyone else on the panel does as well. And I think what we're here to do today is to figure out how close can we get to where no one has to sit in jail, at least pre-trial. Thank you.
Thank you, Representative Hatcher. Also like to invite Vice Chair Representative Greg Sturwald to make some opening statements. Sir?
Thank you, Mr. Chairman. I was asked to make a few comments and go back to some of the things that we did and looked at and reviewed that became a part of 1006, the Criminal Code and Sentencing Reform. That was ultimately passed and took effect July 1st of 2014. You know, our memories fade and sometimes we forget all the work that was done. That began, actually, Governor Daniels formed a bipartisan group and created the Criminal Code Evaluation Commission. over the years, the last time that the criminal code had been thoroughly reviewed was back in the 70s. And over that time, there were so many amendments to the criminal code that there were inconsistencies, there were different definitions in different parts of the code, there were disproportionate within the different types of crimes. So when that commission was formed, I was a part of that. The Criminal Code Evaluation Commission actually hired and retained and formed a staff committee, and that was chaired by that Chief Assistant Attorney General Deborah Daniels, and there were 7 people on that subcommittee just to help us to get everything sorted. They spent thousands of hours themselves and make recommendations to us. Then when the Criminal Code Evaluation Commission met, I started out, first people invited to a meeting was the Prosecuting Attorney's Council and then the public defenders. That grew to include the Community Corrections, Probation, the Judges Association, the Sheriff's Association, Department of Corrections, and it was so successful that they asked if I would put that in statute so that they could continue to meet and make recommendations to us. So we did that. But I want to remind everybody what the purpose of 1006 was, and that was that we wanted to make our criminal code consistent with our Constitution, and that being that all penalties shall be proportioned to the nature of the offense, and that the penal code shall be founded on the principle of reformation and not vindictive justice. We actually included a part prior to, in the beginning of 1006, what the purpose was and what we're trying to do, and those were to reduce crime by promoting the use of evidence-based best practices, keep dangerous offenders in prison by avoiding the use of scarce prison space for nonviolent offenders, give judges maximum discretion to impose sentences based on consideration of all circumstances related to the offense, and maintain proportionality of penalties across the criminal code, and to make the lengths of sentences served by the offenders more certain for victims. I'll leave you with a couple of statistics. This jail overcrowding is an extremely complex issue, and nothing I say on these statistics, I don't want to take that I minimize the complexity. But I think it's important that we kind of put it in perspective. A little over a year ago, there was a snapshot taken of all the jails in Indiana. There were 44 at capacity. If every level 6 felon had been removed from jails at that point in time, there were still 31 or 32 jails at capacity. If only 1/2 of the pretrial detainees were released from jails at that point, the jails at capacity went from 44 to 11. And I say that just to put that in perspective. We also have seen from 2015 through 2018, just those 3 years, the pretrial detainees in Indiana went from about a little over 10,000 to 17,000. So in 3 years, the pretrial detention population has gone up 70%. And lastly, what we heard, and some statistics in the PowerPoint that was given to us at the last meeting, but there's a lot of good information if anybody wants it. It's really good. We're really starting to get some good data as a sign of a cooperation between all of us here. And that being that there's been, in the first 7 months of 2019, there's been 9,461 pretrial detainees actually served more time than their sentence. There are a lot of factors in there. Some of those can be explained, but some of them we don't think we can. We're trying to take a deeper dive into that. But that kind of puts in perspective some of the things that we're trying to deal with and some of the factors that we're considering. So I appreciate your time and thank you for being here.
Thank you, sir. And again, our charge is to make findings and recommendations to the legislature, to the executive branch, in order to help them make some of the very difficult policy decisions, funding decisions going forward. Please remember, if you have not been asked to present or have not signed up to present today, You're probably not going to be able to present or provide public comment today, but there is a place on the website seen on the screen where you can go online and make whatever comments you want, make whatever suggestions you want, as long as you do that no later than November 8th at 3 p.m. So that's open 24/7. So think about what you think this organization, this task force needs to know, or some suggestions you have. All comments received by that day will be considered in addition to the information presented at the various task force meetings. We have one additional task force meeting scheduled. That's next week, November 6th, at Anderson University from noon to 3 p.m. And the task force can, at its discretion, schedule additional meeting or meetings if necessary. We are required to submit our final report and recommendations by December 1st, 2019. This meeting is also being recorded and broadcast live on the internet. In addition, this meeting may be archived and placed on the task force website. Before we begin, again, I'd ask you to turn your cell phones off. We certainly don't want to interrupt any presenters, and we don't want any distractions or diversions. Our goal is to listen very carefully to your remarks, and we want to be able to do that without any, again, distractions or diversions. We appreciate your cooperation. At this time, I would call upon the task force members to look at and review again, having reviewed the draft minutes. They've been provided to you. I know we were talking about those and talked about those previously. And would ask, are there any additions or corrections to those task force minutes? If so, if you could identify yourself and tell me what your corrections or additions are. If there are no additions or corrections, is there a motion to approve the minutes of the task force?
I move to approve the minutes of the previous meeting.
Thank you, Senator. Is there a second?
Second.
Thank you, Sheriff. Any opposed? Motion carries. The minutes are approved. Thank you, task force members. We'll now begin with the scheduled presentations. We have 4 presentations scheduled today. At the conclusion of the presentation, task force members may ask questions. We have an official timekeeper because we have specific time allotted for those presentations. I want to be mindful of the public testimony and the schedule. Each presenter's time will include taking questions from the task force members. Our first presentation is made on behalf of the Office of the Attorney General, the Jail Chemical Addiction Program called JCAP. And I'm a former trial judge. Justice Goff is a former trial judge. So we know a little bit about trial judges, and we know Porter County has fantastic trial judges. But to present today, we thought Porter County might like to meet and hear from a Southern Indiana fantastic judge who's going to present the panel with the details on the program. So Judge Sally McLaughlin, Dearborn Superior Court 2. Welcome, Your Honor.
Good afternoon. I'm going to be just speaking to our jail chemical addiction program in Dearborn County, kind of how we came about having a jail chemical addiction program, what its impact has been on our community, and where we see going forward with it. Have a PowerPoint presentation. Just basically, our jail chemical addiction program's been in effect since 2007. I was a new judge at that time. Prior to that, I'd been a prosecuting attorney in our county, and Ohio County. We're actually a joint circuit, Dearborn and Ohio County, for 3 terms. And prior to that, I had been a nurse. I'd actually worked with the Veterans Hospital, Children's Medical Center, and was the director of nursing of our current hospital. So we were looking at something to do differently with the drug crisis in our community. At that time, our jail was overcrowded. We were never at our preferred capacity. We were always way over capacity. I think our area probably was impacted pretty quickly with the opiate heroin addiction. We're just a brief way away from Cincinnati, Ohio, northern Kentucky. It's just 15 minutes to the greater Cincinnati airport from Dearborn County's line. So we began to see a lot of this early, and we've had the JCAP program in effect for over 10 years. We teamed up with Indiana University, and you should have a handout from that, in 2015. They did a study of our JCAP program, which at that time was in effect for about 7 to 8 years, and they found that we did reduce recidivism with the people who had been through the JCAP program, and we have joined forces with the JCAP and our problem-solving courts, and they work together. So this basically just goes through how we came about it. We actually went to a seminar by the Judicial Center to look at this, and we went to a breakout group with Judge McClure from Boone County, and they had a jail chemical addiction program. We took our sheriff, prosecutor, and a group up to see it, and they actually had us meet with the people in the program who provided a presentation. Our sheriff was so impressed, even though we had no space for it, he said, we're going to find out a way to make this work. So we started with our jail, where we had the old-fashioned jail with all high security cells. We really weren't equipped to have pods or education, but we figured out how to make it work. The main component was having a master's prepared social worker who was the treatment provider and designed the program. Our original one, this is saying the battery is running low. So I don't know what to do. But at any rate, our original treatment provider was Ron Michelson. He currently works with the Veterans Court program in our area, and he really made a lot of the initial things. I'm just showing you where we're located. Dearborn County is about a population of around 45 to 50,000, to give you an idea. We do house Dearborn and Ohio County inmates in our jail. The program is an average of 90 days. They do have individualized counseling, group counseling. It's an evidence-based program. We use CBT. And I think the main purpose of it is that it puts people on separate pods. We have a male and female pod. To give you an idea how well this was accepted in our community, they decided several years ago to expand the jail. They actually accommodated the new jail to fit with the JCAP program. And in our community, if you say JCAP, people know what it is. It's actually impacted the whole community, because we have quite a few people who've been successful, some as long as 10 years, who've become very involved in the community. Part of that is because we used the sample we saw in Boone County, where they shared their program with us. We started doing this regularly, bringing in community leaders, some of our legislators, teachers, to see the program, and we actually had the people in the program presenting it. Put a face on for them, or who were the people with drug problems in our community. Many times they were very surprised to see that it was the college athlete that had gotten a scholarship that ended up with a problem coming back to the community. It might have been someone that they didn't expect. It also might have been faces they did expect, but it was a very positive program, and it's spread throughout our community. These are just some of the participants. They all tell us that they feel that the intervention of jail actually helped. In our area, it can't go right to treatment. If we had someone come to our jail with a heroin, methamphetamine problem, they are not going to get in treatment within 24 hours. It's going to take a while, and the jail chemical addiction program has been a lifeline in our community for families. It's a volunteer program, and many of them are pre-trial. However, so they're in the pre-trial statistics, but once they go into JCAP, the prosecutors and people work together. It's in some ways like a diversionary method. So these are people that might have otherwise been going to the state penitentiary or getting sentences that would be felony convictions, that have a route where they get treatment and another alternative through the jail, which has really worked for our community. In addition, As I stated, it's an evidence-based program. We use CBT. We are certified by the Indiana Division of Mental Health and Addictions. And there is testing to see who is appropriate to apply. These are moderate to high substance abuse offenders. We do allow people to reapply for the program. And as I stated, many at this date have been pretrial, some are after sentencing, and some are probation violations. And one of the other positives of the program is that it has a mentorship component to it, and a lot of the individuals who go through the program learn the mentorship component of it and then take that back out into the community. They're used regularly with programs in our community for schools and a lot of special projects. They're actually on a lot of committees. Currently in our community, we have a CARE initiative that the mayor has joined up with the governor's office, and the JCAP graduates have been a big component of that program. Just basically, we also have parenting classes, life skills. They all have an individualized treatment plan. Many go to our problem-solving courts afterwards. If not, they go through our community corrections, case management programs, or probation. And I don't know quite how this is going to work. I had just a news brief that should have had an arrow in it that I can...
Deborah Dixon.
Oh, here it goes,
Deborah
and it
Dixon
actually
went
shows
behind
our
the
new
jail doors to
JCAP
find out
pod.
how it works.
These women were in jail and addicted to something when they asked to be part of the treatment program. Counseling is intense and includes homework.
There's a lot of deep soul searching
Oh, yeah.
questions.
These steps help a lot, though.
They do.
They do. They do.
They do. They are
Makes you think.
amazing.
We
Helped.
deal with a lot of guilt and
Pain, rejection.
Yeah. Forgiving others.
Everything that I did was based around the next high.
Mother of three, Nova Taylor, went through the program after her drug dealing arrest. Now she's on probation.
I can definitely remember moments that I wanted to get sober, but I had no idea how to. And then there were times where I had just come to terms with, okay, this is how I'm going to live the rest of my life. I will die like this.
Nova is a mentor for the treatment program now.
It taught me that I can be a good mom, and that my kids will be able to forgive me, and that I can be a productive member of society.
The heart of the program is cognitive behavioral therapy programming, or deprogramming how an addict thinks.
They also do a lot of relapse prevention groups. Really helps them with their preventing the relapse again, the healthy lifestyle, healthy boundaries, really using their new thinking skills.
Right now, this program accommodates 16 women, but it's going to expand to accommodate 24 women and 24 men. For men, the treatment program started in 2007. For women, it started 4 years later. It runs on probation fees and grant money. A new $90,000 grant will pay for the expansion.
They can't get the drugs while they're in the jail, so they have to stay sober, and they focus on their treatment intensely for 90 days, and I think that's the key to success for our programming. And I think if it could be duplicated throughout the state, it would be key for the state.
Inmates have to ask to be in the program, and they are promised nothing in return except hope.
One of the things that I tell people all the time, when you take hope away from somebody, the things they do are scary. But we have to give hope back to people, and this is what our way in Dearborn County of doing that.
Deborah Dixon, Local 12 News.
The 90-day program includes aftercare.
Okay, and this is just the handout of the brief we teamed up with Indiana University to do. We're in the process of doing another study with them. Since the program's been in effect, we have not used any county tax dollars for staffing. We now have 3 master's prepared social workers. Our program has them with offices in the jail. That's been very helpful to us because it's helped kind of mesh the jail working with the master's prepared social workers, and we're getting ready to expand some of their role in the jail that I don't think there would be the same trust if they hadn't been there over the last couple years working in the program. We're looking at next steps. We're looking at, in our jail, we are not overcrowded now. Part of that is because we've had the expansion, but our jail population is actually down each year by about 20 people. We're below where we were when we created the JCAP program, even though we have the additional beds. And we've had a lot of problems with work release not working for us. Through an initiative in our community, we're looking at taking our work release area and making that more of an outpatient type programming where they can go to work release. We're teaming up with Ivy Tech so they can get some training while we're there, and that's one of the uses we're looking at. So we've just had a lot of momentum with this. How this started with us is, like I said, we came to a judicial conference to look at different things, and I think the Boone County JCAP program was kind of a little bit under the network. I think we might have been the second one. I know there's other ones that have come about, and I think recently the Attorney General's office funded Kosciuszko County, Shelby County, Montgomery County, Elkhart, Franklin, Fountain, and Warren County are working together, and I think they're looking at another county to try working on these. And what we're finding in our jail, I'm sure we do have some people, and I think with the new initiatives with pretrial release that we're going to identify those, but for the most part, we're not finding that we are keeping the bad check people or driving while suspended. Oftentimes those people are just summoned in to begin with. But where we're seeing this program as a help, particularly in the area of community safety, I can't tell you how many times as a judge we have people who are arrested that just injected themselves with heroin and are passed out on the interstate, or even, in one of the communities at a red light didn't wake up, or they've gone to the McDonald's. They're in positions that they're really not safe, and they're not ready to just go be released immediately. And these are level 6 felonies, and sometimes they're only charged as misdemeanors. So we're not taking people in the JCAP program who can be treated other places. These are people that don't have a place to go. And in some ways, they're kind of working like a diversion, although we're not calling it that. Many times they do get a conviction, but then they are treated in a way that they have an opportunity for probation and other things. And all I can tell you, in our community, it's had a huge impact. The people who've been successful, we usually bring them with us when we make these presentations, and they do help with people who are losing their family through Chin's cases. One of our star people, they both were imprisoned with heroin addiction. They both were kept pre-trial. The man went through the jail chemical addiction program. It wasn't available for the wife. He actually took the workbook home and helped the wife work through it. The wife now has a master's degree. She had no education prior to this. They had 6 children that were in the process of being taken away from them. Their children are all with them. They are working in peer recovery, and they're just one of several that have been stars for us in our community. So, any questions?
Thank you, Judge. Members of the task force, any questions? Yes, sir.
Thank you, Your Honor. That's really awesome work you're doing down there. Are there any time cuts associated with the program? And I know there's no promises.
We don't give them ahead of time at this point, but the prosecutors bought in, the defense attorneys are bought in, so pretty much if they're successful with the JCAP program and complete it, they're going to get a much better deal than they would have. Oftentimes, they're not going to the state penitentiary where they would have, or they're not having a long sentence in our jail. They're moving on to a community correction program or our drug court program.
Thank you.
Yes.
Yes, sir. Sheriff.
Judge, I just had a couple real quick. How do you deal with the 90 days in the program? The average length of stay in my jail for everybody involved is about 22 to 25 days. It's a little longer for a felon person, but it's still only about 44. And then second, your community, you said your jail has grown, but I don't know that your county has as much. How are you dealing with sort of the warm handoff reintegration piece when they get done with the JCAP? Do you have somebody in the neighborhood that supports, that comes and picks them up so they can go to that next step?
Well, we until recently didn't even have housing in our community, and actually through the CARE initiative that the governor's been involved with, our mayor with, and some of the JCAP people, we do now have some housing, but that's been a problem. How they stay the 90 days, we may be one of those counties that has more people staying in on pretrial. We have traditionally looked at people with major drug addiction problems being a community safety risk, so that's been a factor. They know that it is going to be taken in consideration with their sentencing, so really what is happening, they're probably serving their sentence that they would have got after. They all have attorneys, so they're not making this decision to go into the program without an attorney. It's voluntary, and they understand that the program is 90 days. So that's how that works.
Thank you.
And we do have tie-ins after. Like I said, many go to our problem-solving court. We work with our community mental health center, and that works with them. With our community corrections, we combine them with probation. We have case managers, in-home incarceration, and then also they have a case plan that connects them to where they're getting their treatment. So it is an individual case plan set up for every one of them. Anything else?
Any other questions for the judge? Thank you very much.
All right, well, thank you for the opportunity.
Thank you. Our second presentation is on the topic of Justice Reinvestment Advisory Council and evidence-based informed decisions. And we have two presenters, one of the Indiana Supreme Court's shining stars, Mary Kay Hudson, and one of the Indiana Prosecuting Attorneys Council, shining stars, Dan Miller.
That'll be good.
Thank you, Justice David, and members of the Jail Overcrowding Task Force. I'm Mary Kay Hudson with the Indiana Office of Court Services, and I'd like to allow Dan to introduce himself.
Dan Miller with the Indiana Prosecuting Attorneys Council.
This afternoon, Dan and I are going to be sharing some information with you regarding activities of the Justice Reinvestment Advisory Council, as well as some of our efforts surrounding pretrial services and pretrial release. So many of you are familiar with the Justice Reinvestment Advisory Council, which was established in 2015 in conjunction with the criminal code reform efforts that Representative Sturwald mentioned earlier in his remarks. The Justice Reinvestment Advisory Council was established for a couple of different purposes. The first is to conduct a state-level review of local community corrections programs, jails, and probation services. And then also to oversee the processes used by the Department of Correction and the Division of Mental Health and Addiction in awarding grants. And so at that same time, when House Enrolled Act 1006 was enacted, there were some funding attached to criminal code reform efforts, both awarded to the Department of Correction and to the Division of Mental Health and Addiction. The Department of Correction distributes those funds through the Community Corrections Grant Award process on an annual basis, and then the Division of Mental Health and Addiction awards those funds through what has since been developed as the Recovery Works program. So those two areas have been the primary function of the Justice Reinvestment Advisory Council. And then subsequently, the Advisory Council may make recommendations to the Department of Correction and DMHA regarding the awards of these grants. These are the members of the Justice Reinvestment Advisory Council, and the council meets on a quarterly basis discussing these issues surrounding funding mechanisms for treatment services and recovery works and community corrections grants. And the Office of Court Services provides staff support to the council. JRAC is charged with providing an annual report to the Legislative Council and the Chief Justice and the Governor's Office. And they have been completing a report since 2015. Last year, in 2018, was the first year that the Justice Reinvestment Advisory Council partnered with the Criminal Justice Institute, who was also assigned to publish a report on criminal code reform efforts under House Enrolled Act 1006. The JRAC committee minutes and grant summaries are all available online, so not only do interested stakeholders as well as members of the public have the ability to see how those funds are being awarded both on the treatment side and the criminal justice side. For the last several years, the Justice Reinvestment Advisory Council has partnered with Indiana's Evidence-Based Decision-Making Initiative. I know many of the task force members are familiar with what we call EBDM in Indiana. The Evidence-Based Decision-Making Initiative is an effort through the National Institute of Corrections that brings together state and local partners to look at research-based ways to improve outcomes and efficiencies in criminal justice. And so Indiana has been a part of that process for a number of years. Dan will talk a little bit more about that in the context of our pretrial release project. But the EBDM group, we have a state team, which is chaired by Justice David, vice chaired by David Powell, has been partnering with with the Justice Reinvestment Advisory Council because there's been acknowledgement among the two groups that there is significant overlap in the interests of those groups as well as the issues that they are looking at and need to face. So about 3 years ago, JRAC and the Evidence-Based Decision-Making Initiative entered into a memorandum of understanding. They would coordinate and communicate on a regular basis surrounding some of the issues that each of the groups are facing. And there is significant overlap in membership among those two groups as well. So when we are taking a look at what's happening with the Justice Reinvestment Advisory Council, the funding needs, how the funding is being put to use at the local level, and some of the successes that we're seeing, it became apparent to the Justice Reinvestment Advisory Council and to the state evidence-based decision-making team that we really wanted to formalize the partnership between those two groups. As a result, both JRAC and the EBDM state team made a decision to propose some legislative changes to the Justice Reinvestment Advisory Council statutes that would both expand the scope of authority and ability for JRAC to review broader criminal justice issues beyond what's currently provided in the statute, as well as expand the membership of JRAC to include some legislative members, a representative from the Office of the Governor, and a representative from the Association of Indiana Counties. And so that is language that's currently being drafted right now, and we hope to submit that to Representative Sturwald for review, hopefully for a preliminary draft coming out this legislative session. What we would anticipate the outcome of that being is that it would increase the ability of JRAC to review some of the issues that we're looking at with this task force, with jail overcrowding, treatment issues, recidivism reduction, and what are other ways that we can work toward improving the outcomes in our criminal justice system. So now I'm going to turn it over to Dan Miller, who will talk a little bit about our pretrial pilot project.
Thank you, Mary Kay, and thank you, committee, for listening to us this afternoon. So, Indiana's focus on pretrial release actually began with two very different paths. The first path was started by then Chief Justice Dixon, who convened a multidisciplinary committee to review evidence-based pretrial assessments. And over time, the discussions within this group involved additional procedures and processes and practices beyond assessments alone. The second path began in 2010 when Grant County received a grant from the National Institute of Corrections to begin Indiana's first evidence-based decision-making pilot. And during the implementation of the pilot, the Grant County evidence-based decision-making team identified pretrial release as one of their focus areas. But after exploring it extensively, they concluded that they could not proceed at that time because both local and state policies and practices needed to change in order for a pretrial system to be fully effective. However, Grant County's participation in the federal initiative led to Indiana's, as a state entity, to be able to apply to the National Institute of Corrections for statewide EBDM technical assistance. And in 2015, we received that assistance, and actually I think the process began in 2014. And that enabled Indiana to bring on 6 new evidence-based decision-making pilot sites. Seated behind me, it happens to be Porter County's evidence-based decision-making team. I was privileged to work with them in getting off the ground floor, so this feels a little bit like a reunion to me. So, at the same time, the state evidence-based decision-making team formed a pretrial work group to work on pilot site expectations for pretrial, data points, a pretrial process manual, and that was on a parallel path to the court state pretrial committee that ultimately gave us Criminal Rule 26. So to avoid duplication of activities, those two committees merged. And it has been my privilege now to become the vice chairman with Judge Spitzer from Grant County as the chairman of that committee now. That merger brought Indiana additional assistance from the National Institute of Corrections, 4 additional pretrial pilots that were not originally part of the evidence-based decision-making pilots, and the original pilot, Grant County, also joined on as a pretrial pilot. So we have now 11 pilots, and this map will show you the distribution of those 11 pilots throughout the state. So our focus is on collaborative teams to discuss procedures and processes. The assistance from the evidence-based decision-making, state evidence-based decision-making team and the National Institutes of Correction essentially involved creating for each county and actually for the state of Indiana a system map identifying low-hanging fruit, that is, changes that could be made fairly quickly without expenditure of funds. One of those changes was that we discovered that Odyssey allowed us to implement a court notification system. In other words, defendants could be either texted or telephoned to remind them that they had a court date coming up, and that thereby reduces recidivism. Incidentally, that's what my dentist uses to remind me of my dental appointments. We tried to open up data systems to tease out those data points that told us who we were incarcerating pre-trial, and ultimately it is hoped that we will be able to tease out the information that will tell us whether what we are doing is actually working and whether the changes we're making are going to make a difference. That has been exceptionally hard for us. Data systems are widely divergent across the state. The next steps are to identify where the county needs to go to implement evidence-based pretrial release practices. For example, an outlay of funds for staffing of pretrial services employees and staff. Identifying a population to target. We weren't able in every county to target the entire criminal population. Ensuring that there is public defender and sometimes even prosecutor representation at those initial hearings at which bail is set. Those are some of the things that were the next steps that technical assistance provided recommendations and help for. The Indiana Office of Court Services and state team members have visited over 14 additional counties to those initial pilots to help support newly formed local teams working on pretrial release procedures. We've also attended or sponsored training throughout the state. The first one there was almost exactly 5 years ago. We sent a team of individuals. I was on that team to Denver, Colorado. Tammy O'Neill behind me was also on that team as well for a pretrial orientation and capacity builder training that enabled us to develop some skills to both implement evidence-based decision-making and build capacity for that throughout our state. You can see several other things that happened in 2017, orientations and training that took place for pilots and other interested counties. I think Tammy also attended with me a pretrial conference in Washington, D.C. that was sponsored by the National Association of Pretrial Services Administrators. And that was also in May of 2017. And then our training coalesced in last month with a pretrial release summit, at which representatives from every county in the state were present, over 800 people present at that. Bernice Corley and I were privileged to both present and to be available for questions during lunch during that summit. And basically, what our next steps are in progress. We are developing a pretrial release certification program similar to a drug court certification program, inviting counties that are already high functioning to certify themselves as pretrial release counties. Highlights of a high functioning pretrial system includes the use of assessments, in particular at a minimum, the Indiana Risk Assessment System pretrial assessment tool, known commonly as the IRAS-PAT. It also includes the notion that defense counsel and prosecution are at the initial hearing present and ready to assist the judge in setting bail. In a high-functioning system, there are locally established procedures to determine pretrial release conditions and responses to violations of those conditions. High-functioning pretrial systems have text and or telephone notifications, and may be coming soon also email notifications to defendants to remind them to appear. Those counties will collect data to evaluate pretrial outcomes, to determine pretrial court appearance rates and safety rates. And by safety rates, I mean the percentage of pretrial defendants not rearrested during their pretrial period. And finally, high-functioning sites periodically review their goals and outcomes using their collaborative team and make adjustments to the procedures to improve those outcomes where necessary. We are working with additional counties who are interested in doing more than simply complying with Criminal Rule 26. Among those are Vigo, Owen, Adams, Whitley, and DeKalb counties. Bernice Corley and I have been privileged to also go with the Indiana Office of Court Services personnel to those counties to help them along. And IPAC has generously made me available for that purpose, but I think we as a pretrial state team are at a crossroads because there are 92 counties in Indiana. We have two challenges ahead of us. One is already taking place in that in 6 out of 11 of the pretrial pilot counties, stakeholder leadership has changed. That has not had an adverse effect, but we need to expect that to happen and to be prepared to assist counties and keep them on board and sustain the momentum that they have already achieved. And then the second challenge that we have is expansion to the rest of the counties as they are willing to come aboard. And while IPAC has made me available, it's not actually my job description. And so there are limits to what I can do, and I think there are limits to what the current staff of the Indiana Office of Court Services can do. So we need some expansion for sustainability there. And that concludes my remarks.
Justice David, may I add a couple?
Yes, ma'am.
One of the examples of the partnerships that will be happening with the Justice Reinvestment Advisory Council as well as the State Evidence-Based Decision-Making Team is under House Enrolled Act 1065 that was enacted in 2019, which actually created this jail overcrowding task force. There was also a provision in that bill that charges the Justice Reinvestment Advisory Council with studying pretrial reform efforts and making recommendations to the General Assembly. So there will also be a report published by JRAC surrounding pretrial issues specifically, and I know that's very much related to the discussions that are happening with the task force. So I think that we should anticipate some coordination among JRAC and this task force and EBDM and pretrial as we have conversations about what recommendations to make to the General Assembly regarding pretrial.
Yes, sir.
Justice David, to follow up on that, I would hope that one of the recommendations that we could propose out of this committee is to endorse that package and those recommendations. I know Representative Sturwald intends to carry the legislation, but it would be nice if JRAC had this group's endorsement to accomplish what Dan and Mary Kay are talking about, because they're absolutely right. We have just a handful of people, and they're swamped dealing with the pilots. When everybody wants to do it, we got to make sure they do it right, because we know that you can really mess this up if you don't, and if you mess it up, it's bad news for that local community. So it's important that this be done correctly and with proper support and oversight.
Any other questions or comments from the task force members? Thank you. Ms. Hudson, Mr. Miller, thank you very much. Outstanding. And for those of you in the audience and those of you that might be watching and you're wondering why many of us up here keep looking down, it's because we have a monitor here, so we don't have to. Our doctors told us this would be dangerous to, so we can look two different directions during the presentations and view the PowerPoint slides. We have another presentation that we're going to entertain, and then we'll take a short break and come back. This third presentation focuses on jail medical services providers, and we have a 30-minute presentation allocated for questions and answers included in that 30 minutes. We have two presenters. One is Quality Correctional Care. Lisa Scroggins, the founder and CEO, is going to present, and also we're going to hear from Advanced Correctional Health. Dr. Travis Shamber is the medical director of Advanced Correctional Health, and Kelsey Gossett is the regional qualified mental health provider. So I think we'll do quality correctional care first, unless you all have tossed a coin or something. And we'll let you keep track of your internal time and sharing that. So Advanced Correctional Health, you'll have to put eyes on Lisa if you're not happy.
You give me the high sign, okay, when I go over?
Do we have our...
Good afternoon.
There we go.
Hi, I'm Lisa Scroggins. I started Quality Correctional Care in 2011, and we are thrilled to partner with many of the counties across the state of Indiana. We wanted to immediately take a little different approach to correctional health care in our jails, as I come from a law enforcement background, and my husband was a sheriff at one point, and so what we saw was just a lot of recidivism. We really wanted to look at how can we help this population as we work to improve their health while they're in jail, figure out a way to maintain that health when they get out of jail so that they don't reoffend and come back to jail. That's kind of the premise behind the business as it started. And I'm very pleased to have brought Dr. Mike Person in as our CMO recently, and so I'll let him introduce himself.
I'm Dr. Michael Person. I've been involved in correctional health care for approximately 13 years now. We took a little bit of a different approach to this presentation. We wanted to base it on the way our company approaches healthcare in jails. And we do that through core values. We have 4 core values that all our employees follow: advocacy, courtesy, efficiency, and safety. We want all our employees to follow all of these values as they treat anybody. We look at our population as patients. We don't call them inmates, they're our patients. So when we look at the medical care piece of taking care of our patients, our advocacy and our courtesy are never going to change. We're going to treat everybody with the dignity and respect that they need. It's the efficiency and the safety piece where jail overcrowding comes into play in our arena. This is the map of the sites that we manage at this point. We're involved in approximately 72% of all jail inmates in the state. And we've seen over the course of the founding of the company in 2011 to current, about a 24% increase in the number of inmates, the average daily population across these counties. So at any one time, we take care of about 12,000 patients over the course of a day. We also provide 5 juvenile detention facilities that we manage and 10 work release facilities, and we do some partial services in a couple other counties as well, but the ones in red are the counties that we are the medical provider for them. You're up, Lisa.
We wanted to talk just a little bit about why there's been such a raise. 24% is a significant number in the 8 years we've been in business. And as we look across the board, and we understand that this is a well-educated panel that we're speaking to today, and you know these problems forwards and backwards. We're simply here to talk about it from a medical standpoint. House Bill 1006 certainly has affected jail population. We estimated when we first started talking about it that we figured we'd see about a 25% increase in population as we worked with our sheriffs and kind of tried to estimate what that would look like. We understand that from county to county that changes. Some jails may house quite a few level 6 convicted felons, and others may be housing a lot of people on level 6 charges that once adjudicated are released as time served. So we understand that that's a broad saying. We certainly contribute the increase in mental illness and substance use disorders as a contributing factor to the increase. And interesting statistic is the increased number of women being incarcerated. I know when we first started the company in 2011, there were very few women pods necessary in jails. It's incredible how that number has changed. If you take a look at that statistic, Indiana, and I'm sorry, I couldn't possibly read those tiny little numbers from this far away, but Indiana and the United States, our number of women incarcerated has grown so much. I think this is from 2014 through 2018. Then we want to talk a little bit about how overcrowding affects medical care, and at which point we're going to let the doctor talk about that because I am not a medical professional.
We're seeing certainly an aging population that's coming into the facilities. Generally, the patients haven't done a very good job of taking care of themselves on the outside. So we're seeing a lot of chronic illnesses to manage, not only the acute things, but a lot more chronic problems. Mental illness is certainly a big issue that we deal with. We're seeing people come in that have a combined issue with substance abuse as well, that either don't think they need mental health services on the outside, or they get a little bit better and they stop taking their medicines and then they end up right back where they were. And again, the patients that get out of jail once and then don't follow up. When somebody is released from one of our facilities, we provide them with at least 2 weeks of medications. We fill out HIP applications for all the inmates that we see when we do our 2-week physicals. And we give them instructions on how to get that turned on. And anybody, all the providers in their community that they have the potential to set up an appointment with and continue the care that we've provided in the jail. Certainly the recidivism that we're seeing with the substance abuse piece is big. And we'll get to MAT programs and things like that here in a little bit in the talk, but that's a vicious cycle at this point that we're seeing is people come in, we get them clean, they go out, they go back into the same situations, the same people, the same social situations, and they end up using again and getting arrested again. As far as the other core value effect, the efficiency piece, overcrowding in general makes it difficult for us as medical providers to do our jobs. The increase in number of inmates that the jail staff has to take care of and manage and keep track of and move from place to place to court to outside appointments leaves little opportunity for us to call them down and see them for sick call. If they put in a request to be seen by a nurse or the doctor, we may not have anybody that can bring them to us. So that's a big problem that we're seeing in jails across the board. Jail staffs in general, there's a lot of turnover. The officers seem to just kind of come and go. There's not a lot of qualified people to come in and fill those positions from what we see. And hiring and training, not only on the medical side of things, when we're trying to hire new nurses and train them, it's expensive. You know, to spend the time and effort to really get somebody into the jail and working efficiently, it's expensive on our end. It's certainly expensive for the sheriff and the county to train somebody new. All of this is, we're seeing increases in movement of inmates between counties. As counties are overcrowded, they're having other counties house for them. That takes an officer out of the jail, leaves less people for us to be able to bring our patients down and see us. Medical visits. When we have to make an off-site appointment for somebody, typically it's generally 2 officers that go with somebody. So, I mean, we try to do as much as we can on site at any one time, but there are certain things that we're just not capable of managing medically on site, so we have to make appointments to specialists outside the facilities, and that requires somebody on the jail staff taking the inmate or patient to the appointment and back. More patients, more medicines. I am amazed when people come in and they list off the medicines that they say they're taking on the outside. I am astounded at the number of medications that people take these days. Part of that is society in general. We all want one pill to fix everything, and we want it instantaneously, and when it doesn't work, we just move on to the next one, but we never stop the other one. So we come to people with lists and lists of medicines. So when we try very hard to streamline people's medications, we try to use things that we know they're going to be able to afford when they get out. Medications these days, as we all know, are just ungodly expensive. Especially if you don't have any insurance and you're paying out of pocket. We want to make sure that you have the best chance of getting those medicines on a regular basis. We're seeing a lot more fights in overcrowded situations, close quarters. People don't get along. So people with any kind of head injury, things like that, they're going to the emergency room to be checked out. A lot more people being transported in and out of the facility. When we pass medications, it's just taking a lot more time on our end. We like to have an officer with us when we're passing medications to make sure that the person takes the right medicine, they swallow it, they're not trying to put it in their pocket, cheek it, give it to somebody else, sell it for a ramen noodle, something like that. I'm kind of going over the same things here. We had a discussion earlier about fitness for incarceration. When people get arrested or detained to begin with, and we think they're either mentally unstable or under the influence of something, or they've been in a car accident and had a head injury, we want them to be seen in the emergency room first before they're brought to jail to make sure that they are medically stable to be in jail. Lisa and I have been to many ERs over the course of the last several months talking about this. I don't think people realize what we have, what our capabilities are in the jails. I mean, generally it's a nurse that's there the majority of the time. Some places, the larger facilities have 24/7 nursing. Some places only have 10 hours a week of nursing. We have physician visits once a week. So most of the time it's medically trained officers that are evaluating these people, talking to the nurses, talking to the providers, and seeing if something needs to be done on a higher level as far as going to the emergency room or something like that. Already discussed the challenges with sick call as far as getting our patients down to be seen, but that leads into privacy issues. We have to be a little bit creative sometimes. I was at Allen County just the other day, and it was going to take 2 officers to bring an inmate down to see me because this guy had a history of assaulting staff. So I went to the door to his cell to talk to him, and it's not ideal. by any means, but they didn't have 2 officers to bring him down. So if I wanted to see him, that was the only way I was going to get a chance to talk to this gentleman. So there's privacy issues there that we need to worry about. A lot of times if we're seeing them not in an exam room, they're not willing to tell us the things that they think are important. There's a lot of distractions. Cell blocks are noisy. It's difficult when you're not in an exam room to really delve into the issues that these people are having. And again, they don't want to be forthcoming a lot of times if there's anybody else around. We try to have an officer with us when we're examining somebody. That always doesn't happen. And a lot of times that interferes with the patient's ability or willingness to tell us what's really going on. The close proximity of these people in an overcrowded situation, certainly we're seeing increase in communicable diseases. We have lots of MRSA staph infection issues in jails because people are in close quarters. Flu season is upon us. That's going to be an issue. Certainly tuberculosis, we're always on the lookout for. The big topic lately has been hepatitis A. We've had multiple outbreaks of hepatitis A at several facilities. The problem there is it's a 2-week incubation period, so these people don't look sick. We house them out in the general population, and all of a sudden they turn bright yellow, and oh my gosh, now we have to isolate them. In a crowded jail, we don't necessarily have isolation cells that we can really put them in on a long-term basis until they're better. So then we have to keep a whole cell block isolated because we have one person that's been sick. We've seen typically 20 cases a year in Indiana. As of this week, there's been almost 2,200. I'm going to let you go, Lisa, because I'm talking too much.
Okay.
Before Advanced Correctional Health assaults you,
Yes.
You have about a minute left.
Okay.
If you could quickly summarize and perhaps give us an opportunity to ask you a question, because certainly you can supplement your presentation later, but I don't want to miss an opportunity for a question.
Yes, we really just wanted to talk a little bit about the initiatives that you people are doing, this task force, the Medicaid exclusion laws that were just presented to the Senate a couple of weeks ago. We had an opportunity at the NCCHC conference about a week ago to meet with NACO's representatives. Some of the things that they're looking for, some of the data that they're looking for to support those 2 initiatives, we already track much of that information. So we really just wanted to come here today to say, please utilize us as a resource. We're in 72% of the counties across the state, and we have a lot of that data already. We would love to be part of that discussion because we really do take our responsibility with our sheriffs as a partnership, and we want to be part of the solution, whether it be an MAT program or the Medicaid exclusion law. Over the course of the last 4 years, we're averaging about 7,000 HIP apps a year that we're applying on behalf of patients. And then someone spoke earlier about a warm handoff. We do a lot of work trying to bring together community mental health providers into the jail to meet with these patients before they're released so that they have an opportunity to establish a relationship, and then the likelihood of them following through on those appointments skyrockets if they've had that opportunity beforehand. So we really do want to take that part of our commitment to our clients and to our patients very seriously. To that end, we were recently just certified as a DMHA outpatient provider. That goes along our future goals of maybe doing some follow-up care upon release and maybe through a foundation or nonprofit. That's down the road some, but kind of the driving force of what we're trying to do is get these people clean and sober and healthy and then help them stay that way so they don't come back. Because really when they're in jail, the truth is jails are overcrowded and many times underfunded and understaffed, and we don't have the equipment. So we are really doing crisis management for the most part inside the facility, and it's our goal to elevate that level of care.
We greatly appreciate your comments and testimony this afternoon. Any questions by task force members? And I'll let you resolve who owes who Starbucks with Advanced Correctional Health. But thank you.
Thank you so much.
Good afternoon.
Good afternoon. I'm Dr. Travis Schomber, Corporate Medical Director at Advanced Correctional Healthcare. Currently, we operate in 15 states and take care of an average daily population of 37,000 incarcerated persons in those states. Today, I want to talk to you about the patient. And I'm going to start out by sharing a little bit of my background. I was an internal medicine physician in a primary care office and setting before I went into correctional healthcare. Before that, I was an EMT, working the rural roads of Grant County, Indiana. So it's good to be home to discuss this with you today. But as a primary care physician, I met a patient named Jacob. Jacob was one of the first patients to establish care in my clinic. As a young practitioner, I oftentimes gathered some of the less desired patients in the community. This quickly got me involved in the care of patients that had complex mental health disorders, substance use disorders, and also spend time in correctional facilities. As I thought about Jacob and about the way that his course went as a patient of mine, I started to think about the way that we operate as a healthcare business. We have 5 prime directives, which we've provided in a handout for you today. Those 5 prime directives are from disease to health, from side effects to no side effects, from discomfort to comfort, from high waste to low waste, and from high workload to low workload. As I put myself in Jacob's shoes as his provider, I went through this and I thought about what Jacob had experienced. He had a disease. He had multiple diseases. He had a mental health disorder, which everyone had kind of thrown around different diagnoses. He also had a substance use disorder, recovering from methamphetamine use disorder. So he was looking to go from a state of disease to a state of health. And all that he found was fragmented care. He would come in and out of my office, miss appointments every once in a while, look to see if he was in jail. Sure enough, he would be there, had a relapse. Side effects. Jacob would come into my clinic on new medications every time I saw him after he came from the local county jail. We thought we were making headway, and all of a sudden it would change, and he would backslide because we had switched medications, and now he's having side effects, which maybe even resulted in some of his recidivism and going back to the jail. Discomfort. Jacob had to walk to his appointments. It wasn't a comfortable life. He didn't have the resources when he left my office to be able to engage in the community. High waste to low waste. I would argue what many people have pointed out today already, that continually incarcerating Jacob was a waste of resource and a waste of time. Instead, Jacob needed rehabilitation. High workload to low workload? Absolutely. There isn't just the patient being affected here, people who deliver healthcare in the system, those who support us, officers that help us deliver healthcare in the system. So as we look today at some of the issues that we're going to try to outline to you in a handout form, I went to med school long enough to have too many PowerPoints, so I'm done. So in the handout form today, we're going to keep in mind someone like Jacob. So what we want to do is we want to just outline to you our unique perspective from what happens on the outside, what we call the outside when talking to patients when they are not incarcerated, and what happens on the inside for patients, and how those two can work together and how they can oftentimes come in conflict. One of the things that we've dwelled on quite a bit so far in many different ways is substance use disorder, specifically opioid use disorder. Certainly this is one of the main driving forces behind recidivism. One of the first things we have to do is talk back to that disease model and remind ourselves that opioid use disorder is a chronic disease and that relapse will occur. What's the problem though? We can absolutely deliver on the inside medication-assisted treatment, and we can get patients to a place where they're stable to return to the community. However, when they get out on the outside, oftentimes there are no community providers engaging in this practice. I was one of a group of 22 engaging in medication-assisted treatment in the primary care office in a larger Wisconsin community where I lived. So as we think about this, we have to think not just about what happens on the inside, but what happens on the outside, and engaging wraparound services in the community. Not only do we need to look at that from a medication-assisted treatment standpoint, we need to look at it from a healthcare standpoint. We have data that shows that patients that come into county jails where we are entrusted to take care of them leave those jails healthier. They come back in, and once again, their diabetes is out of control. They've stopped their statin for coronary artery disease, and things have really become a struggle for them. And so that coordination between outpatient and inside is once again a factor that is very, very difficult to address and is one that is a constant struggle. I do want to mention, I know many of you are legislators or are involved in the government in that capacity. There is a law floating around at the federal level to try to remove some of the burdens, specifically the DATA 2000 waiver and X waiver for medication-assisted treatment with buprenorphine. Currently, that is a bottleneck where providers have to actually do online training and get certified, depending on their degree level, to be able to prescribe this medication in an office-based setting. And that's really what we need, is access to care. I sat on a lot of phone calls and realized that as I sat and they say, what can you guys do on the inside? We don't have people from the community setting engaging for continuation of care on the outside. One last thing I will speak to the medical side before I ask Kelsey to speak to some of the mental health needs that she sees in the jail setting is we are also able to establish accurate diagnoses for patients when they come into the facility. The problem is that right now the health system is so fractured that we aren't always able to have those diagnoses follow patients back to their primary care physicians. When patients then go back to their primary care physician and they say, well, gosh, that jail doctor's really screwed this up. Let's get you back on all the medicines you're supposed to be on. Not knowing that we've taken time to try to actually meet the patient's need, reduce polypharmacy, and get them the care that they need. So as we look at this, I don't want to be so narrow-minded to think that a correctional healthcare company is going to help with the impact of recidivism on our own. We have to have engagement from community leaders, and to that end, I certainly thank you for allowing us to be a part of this, and we would certainly be happy to do that in the future. I'm going to now allow Kelsey to step up and talk about some of the mental health concerns that we see in the incarcerated person population.
Thank you. I see that I have about 5 minutes left, and it's no joke that 5 minutes isn't near enough to be able to review the mental health challenges that are faced for our patients when they're released from the community, as well as the great things that we are able to do inside the facility. I can say quickly, one of the number one challenges that we encounter is a patient's motivation to change. People come to jails in crisis. It's the same population that enters an emergency room. So by virtue of the fact that they're coming in crisis, they're not always ready to make the huge changes that need to be made in order to walk away from their addiction, to change their people, places, and things. Community access after their release, getting the patient linked up with the community. We can file for HIP, we can get them the insurance that they need, and give them the handout that says that they need to follow up, make a phone call to establish an appointment. Getting them to that appointment is hard. The moment they walk out that door, 90% of the population that we are working with has a serious addiction. The moment they walk out of the jail, that's their first opportunity for relapse. By the time they've come to jail, and it's typically a revolving door, by the time they come to jail, they've lost a lot of their social support, their resources. The people in the community that support them are their fellow addicts. Their families usually disappear. So just getting access to the services in the community. I know Sheriff Clark in Hendricks County, you guys are doing a really great thing by working collaboratively with the local community health center, doing teleconferencing prior to their release and getting them established, getting them a face-to-face over video appointment and establishing that connection so that we can get them as connected as possible prior to their release. State hospital placement. Jails are our inpatient psychiatry units. This is where people are going. This is where people are showing up and living with severe mental illness. The average wait for a person to be identified that they may be incompetent to stand trial, may need placement in state hospitalization. Last time I spoke with the director was about 5 months. That means that patient stays 5 months incarcerated, likely refusing medications because they lack insight to their severe mental illness, and before they can ever get help, they sit for 5 months. Oftentimes, this is an individual that doesn't function well in general population, meaning that they're likely to be segregated even within the jail. Oftentimes, segregation means that they only have 1 hour out of a 24-hour period to do the things that they need to do to take care of their hygiene. It's all too easy for someone who has to endure that long of a wait to deteriorate. What we're doing on the inside, I know I've got about a minute left. We will only hire licensed professionals to come in and work within the facilities. We follow state and national standards with regards to treatment. One of the big things I wanted to touch on is the officers within the jails. They are the front lines. They are oftentimes our eyes and our ears. We are actively pursuing all of the jails that we have contracts with to help the officers with their own mental health. We have a critical incident rapid response team to help mitigate trauma, secondary trauma that officers are dealing with as a result of working with a very sick population. We are also pushing mental health first aid. Our company has recently gone and invested in a handful of providers to become instructors. Mental health first aid is effectively the mental health equivalent of CPR for the medical profession, to encourage and to help officers not only interpersonally, but within the jails to be able to identify mental health problems and then respond in a capacity that will help them get help. Again, it's that most people know the basics of CPR. Mental health is no different. It can be a very serious condition that can kill someone. I'm out of time, I believe. Do we have any questions?
Members of the task force, questions?
Thank you very much.
Thank you. Ladies and gentlemen, we're going to take a short break, short recess, and we're going to reconvene by 2:45. We will be inviting all previous presenters, today's presenters, first session, including the next session, to email us their top 3 suggested findings that we should consider, and their top 3 suggested recommendations that they would like to see in their perfect world from their perspective, what we consider included in our recommendations. So with that, we'll take a short recess. We'll reconvene at 2:45. I apologize. I think I'm the one that caused the delay. We'll get started in just a moment. Waiting on one of our partners to rejoin us. We're going to have a presentation, local programs and initiatives. So it's great again to be here in Porter County, and thank you for your hospitality. We're going to get a plethora of people that are going to come forward and tell us a little bit about the great things going on here in Porter County. On behalf of the task force, we cannot emphasize enough how much we appreciated the time the sheriff and his jail commander, Stephen Lawrence, took to give us not just a tour, but a real exposure to the programs and great things that are going on in the Porter County Jail. We actually got to visit with inmates in different programs, and it was really a significant event for us to see what some of you have been talking about and what some of you are doing in your communities, but an opportunity to witness it firsthand, particularly someplace that you may not be familiar with. Nothing short of it extraordinary. And I think to paraphrase the sheriff, our priority is safety for the community, but we understand that while there are some very dangerous people in our jails that have serious challenges, the vast majority of those individuals will be released and be in the community. And if we're not taking advantage, and if the community is willing to support, and we can provide assistance to them, those that are ready, willing, and able to change, much like what's going on in Dearborn County, then unfortunately, let's take advantage of the opportunity we have and fortunately do good and help those individuals. So without further ado, I'm honored to introduce your sheriff, Dave Reynolds, who will master of ceremonies for this next presentation. Sheriff?
Thank you. Thank you for the kind words. I was supposed to welcome you at the beginning, so I'm welcoming you now, and I wanted to thank you for taking the opportunity to be there on time, and I know we probably went over limit. Most of you I think I've met before. I'm not going to really talk at all about what you saw, but we're real proud of what we're doing in the jail, and whether you believe this or not, none of that was orchestrated. We just walked in. They didn't know we were coming, and it just so happened. It was fortunate that everybody was kind of available walking around, and so I think you got a really just a unresponsive look of how we do what we do every day. And I didn't want to orchestrate it. I wanted to just to go in there and say, hey, this is what we do. And I think you saw that. I just want to say, you're going to, and I want to, she might be gone, but I want to give a shout out to we have quality corrections, and I'll say one word which describes that company: they're responsive. If we have an issue, we call them, they respond. And as a sheriff, you can't put a price tag on that. The one thing I think, I've been through this a long time. Like I told you, this is my fourth term. And I've been to a lot of these committees. I've seen a lot of task forces, and it's a credit to you guys that you would drive up here, and because you care about that there, and you know that there's a need and there's a problem. But one thing I want to just kind of leave you with this is that two things. One is that you should be tasked with identifying the issues and the problems. But when you leave, you need to come up with some kind of, because I go through all this all the time, and we're always talking about problems. Well, we got problems. We know that. I'm like, we got a drug problem. Okay, what are you doing about it? But if you guys would come up with, identify what the solutions might be, and then once, I forget who said it, I think it was Representative Greg Sturwell, when he said it's a very complex system or problem, and it is. Overcrowded is complex. What my problems are not Hendrick's problems or not Vanderburg's problems, but fortunately, I don't have a overcrowded problem. But we have problems, and you're going to might hear today, in the 92 counties, the only way you're almost going to have to look at this is look at what the problem is for each county and try to identify what the solutions are. Because what you're going to see, some solutions are, some of these counties need a bigger jail. I mean, the populations grow, and more people are in the county, you have more problems, you have more people getting arrested, and it's not anybody's fault, but it's just the way it is. And the second thing, there's a system problem. There is definitely a system problem, between the prosecutors and the judges in certain counties. And if you see that, but just looking at certain counties and saying, hey, there's a county not too far from here, 100 inmates. 100 inmates. Half of them are 6s. I mean, how does that happen? I mean, how does that happen? We have like 10. And I have 190,000 people in my county. This county's probably got 40. And what you said, Representative Hatcher, I understand what you're saying, but that's really not happening. I mean, there's not anybody in these jails driving while suspended, believe me. I mean, if there is, that's a problem, okay? If that is happening, that's a problem. The other thing that I want you to leave you with as I close is, and I talked to Representative Greg Sturwell just about 3 weeks ago. We had and I don't want to, because I mentioned it before, but it's important enough since there's other people watching this. We had a 30-year-old, a court order to pick up a 30-year-old lady in Lake County, Edgewater, in Gary, because she had committed a crime. And she was acutely mentally affected. They want me, I had a court order to go pick her up, take her and put her in my jail. She has a mental capacity of an 8-year-old. Well, most of you went through my jail, you know I don't have the facility to house an 8-year-old, a person who has a mental capacity of an 8-year-old. So what do you do? If you're the sheriff, what do you do? Well, number one, you better probably honor the court order, okay? Well, I kind of didn't honor it right away, but I talked to the judge and we had a hearing, and eventually he made the right decision, and a decision I agree with. I had to go pick her up, but then I worked it out where I took her to Lake County because they have a mental health ward. But the point is, that girl should not be in our facility, and that is a primary example of what's going on throughout the whole state, is that there is the mental health facilities in Logansport and in Madison are not equipped to handle the problem. And and you saw there's I have another inmate who's been there since February and waiting to get housed in a mental health facility. She needs to be in a mental health facility. She's basically in there on no criminal charge. She attempted to stab somebody, I guess. She had a knife. I mean, she attempted to do that. I mean, come on. But she's there. I understand why she's there, but you as a task force that is a problem that every county, every sheriff is dealing with. No sheriff has got the facility to deal with mental health. We don't. You know, we do well with, we detox them. And we have 95% of my jail population has a substance abuse problem. And one of the statistics I saw up there today is absolutely right. When I was sheriff in 1999, I had 11 females. Today I have 70. Every one of them has substance abuse problem. Okay, but now we can handle that and we're dealing with it. But right now I have 3 with a severe mental health disorder. I don't do well with that. I mean, I have padded cells. You want to put this person in a padded cell? I'm not asking you for the answers. There is probably no clear answer to it, except when you leave your next meeting, and then you have all these meetings, if you could come up with possible solutions to some of the problems that you've heard in these meetings, then that would be great, because you're going to have the support of the sheriffs. The sheriffs are looking forward to what you're going to do. And then, it's just an honor and a privilege that you guys would take the time to come to Porter County to see what we're doing. And I know you're trying to make a difference and you're trying to do the right thing. So and now I almost messed up. There was one other thing I'm supposed to do. I'm supposed to introduce a person that I really like. She's the director of the Porter County Pact. A lot of what we got with DLC, it would not have happened. I mean, I thank DLC and I've thanked him a lot of times today, but who wrote the grant is Tammy O'Neill. Tammy? And I'm in her debt.
Justice David and members of the task force, welcome to Porter County. Like Sheriff said, we're so glad that you were able to join us. We always get excited to be able to share with other people the things that are going on in our county. This morning, you got to see firsthand what we get to work with every day. So what the sheriff and his staff have done, not only within the walls of the jail, but also in the community, is really a huge reason why Porter County has been able to make so much progress in our response to substance abuse as we try and respond to the increasing needs of mental health in our community, the work that we've done with pretrial and other alternatives. So what I get to do this afternoon is also introduce you to other members of our team. Each member that I'm going to introduce plays a key role in the way that our county addresses the issues I just mentioned. So without further ado, I'm going to introduce them. As you hear from them and you hear what they each bring to the table, it is the reason why we can say as a county with confidence that we truly are a collaborative system. And again, we're so glad you are here to join us. So the first person, let me see if I can get this, Don Evans. Don Evans, some of you may recognize, he has been with Corrections for many years, and he actually was part of the group who authored the original community corrections legislation. So currently, Don has a role of Community Corrections Advisory Board Chair. Don also is our EBDM Policy Team Chair. He heads up our pretrial work group, and he's a member of our EBDM Mental Health Group. Judge Michael Drenth was unable to be here with us today due to a family emergency, but Judge Drenth is Judge of Superior Court 3, and he oversees not only our adult drug court, but he also oversees our Veterans Treatment Court, and he's a member of our EBDM policy team and is the judicial liaison for our pretrial project. Steve Lawrence, who's the jail commander, he's a member of the EBDM policy team as well, pretrial pilot work group, and the EBDM mental health work group. Jay Berkey, who you met at the jail, the chaplain, he's also the program director. He leads the Porter County Vivitrol program team and is a member of Porter County's mental health and court program team. We've got Gary Gurman with us today, who's Porter County's prosecutor. He's a member of the EBDM policy team and Community Corrections Advisory Board. Ken Elwood is with us, and he is the Chief Public Defender and member of the EBDM policy team and pretrial work group. Melanie Gollenbeck is with us, and she is our probation chief, and she's also co-coordinator of our EBDM policy team and a member of the pretrial pilot work group. Amisha McDonald is our coordinator of electronic monitoring services and community community corrections, and she's also our team lead for case management and pretrial assessment in Porter County's community corrections program. She's a member also of the EBDM pretrial work group. And we have Todd Willis with us. He is the Director of Prevention and Education with our local community mental health center, Porter Stark Services. And he's a member of the EBDM policy team, and he chairs our mental health committee work group. So I would first like to introduce Don Evans, and then Don, each person will introduce the next member of our panel. So thank you again.
Thank you for the opportunity, and thank you, Tammy, for your kind introductions. I've been asked to help describe how you develop a shared vision that allows things to be created like we have in Porter County. Not that we're perfect, but I think it does go back, in large part, its origins go back to the Porter County Community Corrections Advisory Board and the creation of the statute that brought people to the table who instinctively hold different views on criminal justice. You have to have a prosecutor on the Community Corrections Board, public defender, judge, mental health people, all those folks who, before the creation of that statute, wouldn't necessarily be at the same table. There may not be ever total consensus among us, but the debate and the tension created by the dialogue has to occur in a group setting. And I think what's allowed us to create some shared visions is getting past the idea that we label people liberal or conservative, or that someone's left or right, or we're hard on crime or we're soft on crime. what allows us to get past those labels is a willingness to explore, in a deeper sense, justice issues. And that allows people to come to a consensus. It may not be pure agreement, but it gets closer because they're looking more deeply into the issues. And they're actually, I think, being smarter about it too. And that, I think, has led to a lot of changes. When we had NIC come here years ago, and our old jail had an overcrowding problem, and NIC gave us a grant. And a gentleman, Ed Latessa from University of Cincinnati, who I know has worked with Indiana extensively, came as one of the primary presenters, and they were here about a week. The last day of the presentation was a community presentation, well attended at Valparaiso University. Ed was one of the presenters. It was election time in our county, and the then prosecutor was in the audience. And Ed mentioned, talking about being smarter, he presented the ideas that putting high risk or low risk offenders into programming intended for high risk people actually increases crime. And that at the time anyway, juvenile boot camps, he described as being great feeder systems for gangs. Well, he didn't have to do this, but at the end of the presentation, the person who was the sitting prosecutor and up for election in the coming days stood up and said, you know, I'm going to change things. I really learned something here I did not know before I came. Stunning to me. I was sitting behind him and I thought, that really says a lot about the ability to converge on some shared values in spite of our being in an adversarial system where people need to fight and advocate for their role in the system. So the Community Corrections Advisory Board's been key on that. The NIC in supporting us has been key. The EBDM committee that's been alluded to has been wonderful. Obviously that required a lot of funding and help outside of Porter County. Nonetheless, Porter County is blessed with a lot of philanthropic minds and a lot of office holders who appreciate the importance of collaboration. And that's primarily what I wanted to say. And I'll take any questions if you have any, but otherwise I'll introduce the next speaker.
Questions?
All right. The head of our adult probation department is Melanie Golumbek. Melanie came to Porter County not too long ago and has been pivotal in implementing our pretrial program here, amongst many other insights she's brought to the table. Where's Melanie? Thank you.
Thank you for the opportunity to come and talk to you about our pretrial program, and that would be my role today, is to share with you a little bit about what we're doing with our pretrial pilot program. When I conclude, each of our other stakeholders will come and present to you what their individual roles are within our pretrial program. I can tell you, though, firsthand that being newer to Porter County, this was my first experience coming into a group that is especially collaborative, and I need to emphasize that that is important when you are looking at a pretrial program. No individual agency can take on this task by themselves. In our programming, we use jail officers, we use community corrections officers, we obviously involve our judges, prosecutors, public defenders. We also bring into play our probation department, and sometimes all these groups don't necessarily play well, but it's important that they come together and have this common goal, which we have, which is to maximize release of our pretrial detainees, to maximize court appearance, and also to maximize public safety. So with that being said, let me tell you a little bit about our program. Our program begins by looking at individuals that actually have come into our jail. Our jail staff identifies our target population and makes sure that those individuals are available for the community correction staff who come into the jails on a daily basis, Monday through Friday, and do our Indiana Risk Assessment System pretrial assessment tool. So this is the assessment tool that we use to help predict the risk that an individual will return to court for their court appearances and whether or not they will be arrested for new offenses during their pretrial period. So community corrections comes in and they do their risk assessment. They then share that information with our judges as well as our prosecutor and public defender. It's very important to us that we have representation for each individual that is appearing at their initial hearing, so we make available public defenders for these individuals. At the initial hearing, the information from that risk assessment tool is taken into consideration along with an individual's criminal history. Any argument made by the public defender's office as well as the prosecutor's office to individual characteristics, and most importantly, judicial discretion comes into play. And that's one thing that is difficult in the judicial setting. It's believed that by bringing in this risk assessment and telling people we're having this risk assessment, that we're taking away from the judicial discretion. And this program doesn't do that. A risk assessment is a tool that helps to add to the validity of the decisions that are being made. At the point of the initial hearing, judges then have an opportunity to make a fair and educated determination for bond for individuals. If the court feels it's appropriate, individuals can then have their bonds lowered, sometimes to zero, sometimes just to a lower amount, and a judge can also make a determination as to whether or not pretrial services are necessary for the individual. That decision is individualized, and that's something that we don't typically see when we look at traditional bond tables. Bond tables look at what was the offense that was committed, here's your bond amount. The process that we're doing now takes an individualized look at the person that's standing in front of you and helps us to determine what this person may do during their pretrial period. If it's somebody that's a low-risk offender, meaning they are likely to return to court, they are not likely to commit new offenses, that person doesn't need to be in our jail. If it's somebody who is a moderate or a high-risk offender, that might be somebody that can get released back into the community with the benefit of pretrial services, where you have a pretrial officer who then provides supervision and monitoring of the individuals. And that is something, again, that's different from the current bond system. Current bond system says if you have the right amount of money, you get released. You get released with no supervision, and we're just letting you go back into the community. By doing an individual assessment, you're really taking a look at what that person may do should they be released. And there are instances where persons should not be released. We're not taking that away either. But should that person be released, and if they are released, should they be receiving services? So at that point, then we will also take a look at conditions, and that's something you hear a lot about with pretrial services. What conditions should be imposed upon people who are getting released? And should those conditions be such that it's expensive for them or they can't do it? We have to keep in mind that these are individuals that have not been convicted of any offenses. Should we be punishing them on the front end? Not necessarily. So when we look at conditions, conditions should be established and should be very minimal, just so that we try to ensure that this individual isn't going to create a public safety risk. Individuals then who are able to post a bond or who get released and assigned to pretrial services meet with a pretrial service officer who essentially stays with them throughout the pendency of their case. So they check back in with their pretrial officer, again, based on their risk and needs levels. People who are low risk shouldn't be reporting in a significant number of times. However, people who are considered moderate or higher risk may need that little bit of a nudge or a push or a reminder. Hey, your court date's coming up. Hey, how are things going for you? Is there anything that we can do for you? Any needs that you have that we can address for you? So that's a service that we're able to provide through the pretrial service program. A couple things also that we do, we look at how do people do when they're receiving pretrial services. So when they're out on bond, what are they doing? Are they having minor violations? And if they are, can we address them in-house? We have a violations matrix wherein we look at what are considered to be minor violations, and we handle those in-house without having to clog down a court's calendar to come in and say, hey, so-and-so missed an appointment. So we can handle those internally. However, we also have established that when there are major violations, this individual needs to be brought back before a judge who then can determine their continued fitness for being out within our community. And maybe at that point, a determination is made that this individual shouldn't be out, but we've given them an opportunity. Lastly, a couple things that we do is we provide a check-back system. So for those individuals maybe who have had their bonds lowered, but they still can't afford to post their bond, we'll periodically take a look at who's sitting in our jail and why are they sitting in our jail. And maybe it's because They couldn't initially post a $1,000 bond, so it got lowered to $500, but they still can't afford that $500 bond. Is this somebody that we could take another look at and maybe reduce their bond even further, allowing them the opportunity to be released? And most importantly, on the back end, is data collection, because what we're doing right now is new. We can't say with 100% accuracy that it works. We're confident that what we're doing is a good thing, but it's important that we're keeping that data so we can show to everybody that what we're doing is working or not. And if it's not working, what do we need to do to address those issues so that we're not increasing risk to the community, so that we're not increasing people failing to appear in court? So those are some of the things that we're doing within our system. How does this impact the jail population? Well, we know, research will tell us that 60 to 70% of jail populations include people being held pretrial. So what does that mean? That means if we're taking a look at that population, that 60-70% of that jail population, we may be able to reduce that significantly by providing them with these pretrial services, by assessing them individually and deciding whether or not they should be within our jail system. And what that brings us to is purposeful incarceration. The people that are in our jail should be people that need to be in our jail. And what impact does this have on our community? Going back to Ms. Hatcher's comments earlier today, I want to point out that when we keep people in jail unnecessarily, we could actually be increasing their risk. So what that means is if you have somebody that's low risk coming into jail who sits there for a significant period of time, there's potential that we are causing more harm to that individual. How does that happen? Well, you're exposing them to higher risk offenders. They're learning things when they're in this environment. Also, you're taking them away from the pro-social activities that they have going on. So these are people that may have had jobs, that just lost their job, that just had their children taken away because they're sitting in our jail for 2 weeks waiting for their next hearing. These are people that no longer have housing. If you don't pay your rent on the first of the month, when you get released, maybe after 2 weeks of incarceration, suddenly you don't have a place to live. And we know that those are the characteristics that bring us to increased criminal activity. So by looking at this type of programming, we are actually reducing risk for these individuals. We're keeping them from having more harm brought into their lives. We're also, and this is very important for the group sitting in front of me, reducing our jail populations. Without actually assigning causation, which we don't want to do, we want to say and we want to point out that within Porter County, we have seen a significant decrease in our jail population. And our sheriff may have shared that with you already. Again, we don't want to assign causation. We can't say that specifically it is this program. However, it's no coincidence that as our pretrial numbers started going up, our jail population started going down. Jail numbers are the lowest that they've been in since the jail opened. I think that's pretty significant. And lastly, and very importantly, is looking at public safety. So what are these people doing when they're on pretrial? We are still collecting data, again, very important. We're still collecting data, but what our trend is showing us right now is that our population, the population that we're releasing onto pretrial services, are showing up to court. They're not necessarily committing new offenses, so they're doing the things that we thought they would be doing. So we're not just letting people out into the community that are victimizing the community over and over again. Our rates are similar to that of national rates, so we think what we're doing is appropriate. Our jail population is decreasing, people are being supervised, community safety is not being impacted. With that, I will turn over, unless there are any questions, I will turn over for more information about the IRAS pretrial risk assessment that we do to Amisha McDonald. Was there a question? Yes.
I had a couple questions. It may be for the next presenter.
Okay.
But, is the IRAS the deciding factor on pretrial release, or can the sheriff weigh in and say, I know this character, I know he's going to get out, beat his wife, or the prosecutor, can there be an override? I'm still learning about it. I know how it works for me in classification, and it works well because we get the people in the right programming. That's my first question.
And Amisha will provide some more detail on that, but I would say in general, it is one of several tools that's used to determine whether or not somebody should be released. It's not the ultimate decision maker, it's one of several tools.
And the second question, and as I learned, can an IRAS score go up just statically based on a person's zip code?
Not that I'm aware of.
Okay, I don't know enough about it, but that, when you see some of the questions that I have, some of them are based on demographics. So,
I don't believe zip code is going to play any
Okay.
role in that determination. There's a set, I believe it's 7 questions that are asked, and none of those questions are related to zip code.
okay.
Commissioners, you have a second follow-up?
That was my two, thanks.
Reese?
Are you able to hear me okay?
Yes.
Okay. Can you tell me, so Community Corrections here in your county does the IRAS interview, is that correct?
Correct, yes.
And then what's the process from there? Like, what happens with the IRAS information? How is it shared with the team? Do public defenders get a chance to review it? Is there time to make sure it's accurate? That type of process.
So Amisha could probably share some more information on that, but I would say that the assessment is done. There's collateral information that's gathered to ensure some accuracy, to make sure we have good information. That report then is prepared and it is emailed to the prosecutor, the public defender, as well as the court. So everybody has a copy of that report going into the initial hearing. Everybody has access to that information.
Yes, sir.
Okay.
Thank you. I'm curious how long it takes to do the assessment, and do you have any idea how many of those you do a year?
So again, Amisha probably can answer the details. She is our lead assessor, so she could probably answer the time frame that's allowed. But the second part of your question, how many do we do a year? So our program is continuing to grow. So one of the things about our work group is that we meet on a regular basis to discuss where we're at, how things are going, are we remaining, do we continue to have fidelity to our program, things like that. So we've made some tweaks and some adjustments to our program. The number of assessments that we are doing is going up significantly because just this past year we added misdemeanors to the people that are being assessed. So our numbers have grown significantly. We were estimating that we were going to be looking at about 800 throughout the year.
Thank you.
Sure.
Yes, sir.
I'm familiar with the pretrial detention risk assessment, but I thought did you mention that for a probation violation, you also have a matrix that measures severity of that?
Right, for pretrial violations, right. So we have developed a violation matrix that allows us to look at what type of violation are we looking at with the individual. Is it a first-time violation? Is it something that's repeated? Is it something that we can address in-house by giving a referral maybe to a substance abuse treatment program or to an education program or things like that? So we can make those referrals within our office. It's not part of a court order at that point. It's just a referral, a recommendation based on the behavior we've seen of that individual.
So for a pretrial detainee on a probation violation, technical, there's a chance they can get out before their court.
I'm sorry, there's a chance they could what?
They could be released before their hearing date.
So when we're looking at those technical violations, these people are not in custody at that point.
Even for a probation violation?
Well, probation and pretrial are two different entities.
Right.
So for a pretrial case, these are individuals that are receiving a different type of supervision.
Right.
So those technical violations wouldn't necessarily mean that they're incarcerated. Now, if there were a major violation or repeated technical violations, we advise the court of that. The court can decide if they want to issue a warrant and take that person into custody or set the matter for a hearing at a later date. But that individual at that point is not in custody.
Okay, very good. Thanks.
Do you use a similar matrix for probationers?
Similar, yes. Yeah, actually, it would be
That may have
something
been
that's
what
similar.
Representative Struble was asking.
Right, to do like administrative probation modification hearings, things like that we would handle internally, right?
Yes.
So just to be clear, the pretrial matrix that you have, it helps your office resolve any technical issues with the person short of alerting the court and
Correct.
Gotcha. So
Correct.
it's just kind of a way to internally deal with any kind of technical issues.
Exactly, exactly. Now, if there are repeated technical issues, that's something we want to bring to the court's attention. But for those first-time minor things, we handle those in-house, thinking that if we can provide something, a response, address a need in this situation, we can keep that from happening again.
Anything else? Thank you, ma'am.
Thank you. Amisha.
All right, my name is Amisha McDonald, and I am the person who goes into the jail during the weekdays to administer the pretrial assessments. I work for Community Corrections, and so hopefully I'm able to answer some of the questions just a few minutes ago. So when we go into the jail, there's a couple things that we need out the gate. That's an escort, obviously, throughout the facility. A computer, copy machine, scanner, and we need an interview room. Our jail has been amazing to us to be able to provide all of that very seamlessly for us on a daily basis. And I know it is a challenge for them, but without hesitation, they're always there to accommodate us. When we go in, there's a list, as Melanie said, a jailer that provides a list of inmates that we need to see for that day. We pretty much see everybody unless they're who is booked in that prior evening, except for murder and treason, or if they're in padded cell, we will go back and see them once they're out of a padded cell. They will escort the individual to our interview room, and we will administer the IRAS PAT. There's 33 questions. Some of them are open-ended, some of them are closed-ended questions. It takes us about 10, 15 minutes tops to do it. We do have some people who are pretty chatty, so those may take a little bit longer, but by and large, it takes 10, 15 minutes per individual. When we're meeting with that individual, we already are supplied with the criminal history of that individual from the jail staff person. We complete the interview, and then we go back and we also go through their criminal history again for accuracy, trying to compare the self-report from the interview as well as what the criminal history has been provided to us. And on Insight, if you're familiar with that, that's the cases, whether they're closed or active. We want to make sure that all the information is accurate. So when we provide the score, it is accurate as possible within the time frame that we have. The 7 items that we score would be the age of first arrest, the number of failure to appear in the past 24 months, 3 or more jail incarcerations, their employment at the time of arrest, and whether or not that's verifiable employment. So we do check that as well. Stable residency, and basically the time frame for that is, have they been able to maintain stable residency within the past 6 months or more? The other things we're looking at is illegal substance use in the past 6 months and whether or not they have a severe drug use problem. So those 33 questions will cover all of those areas for us to be able to score. Once we score out the assessment, we go back to the space provided to us. We, again, do further checking to make sure the information is accurate. And then we provide a brief report to the presiding judge, the prosecutor, public defender, as well as the probation department. So everybody's on equal playing field with the information provided. So when they go before the court for their initial hearing, everybody's on equal playing field and they can have a meaningful first appearance. The person who administers the assessments for any county going into the jail would need to be IRAS certified. That certification is provided through training through the Indiana Office of Court Services, and they would need to pass the test. And so right now, individuals who are qualified to be able to take the training would be either a probation staff person or someone in community corrections. Most, I would imagine, all of probation staff have IRAS certification, as well as any case manager through a community corrections will also be certified to administer the IRAS. I'm sorry. Community corrections, beyond that point, once that information is provided to the court, then it goes to the judge, prosecutor, public defender. Public defender comes in after we meet with the individual. Typically, it is within half hour after us meeting with that individual. They're provided the information to be able to argue their bond and release conditions on their behalf. We have 3 current pilot courts that are staffed with public defenders to meet with the individual after we've done the assessments. But we assess all of the individuals for all 6 courts, but we do have the 3 pilot courts that we do offer the public defender for. During that assessment, we also read them a waiver. It is totally voluntary. It's not mandatory or required for them to participate. So they are made aware of who gets the information, the things that we can discuss and not discuss. We never discuss any of their instant offense information. We're only talking about past history. So that's made clear to them as well. When you get in that room, that's the first thing I want to talk about is why am I here and what happened. And so we cut that off really quickly. And the waiver really helps with that and understanding that this is here only for a specific purpose. As Melanie said, one of the reasons for the IRAS PAT, it was designed to only predict failure to appear and new offenses while out on bond. So please try and keep that in mind moving forward, is we're not trying to predict behavioral change, just those 2 factors. And I know sometimes that's a real struggle when you look at the criminal histories, but we're only looking for a certain period of time as whether or not they're going to appear for those court hearings and commit no new offenses out on bond. Some of the alternatives and supports that are available to people in community corrections and services that can be provided through community corrections through pretrial is we do have what's called Recovery Connection, which is a recovery support program that is free of charge for individuals who are within the, once they're released within the community, to offer recovery support, positive pro-social activities, and as well as support for their family members or support systems. There are some community correction programs that also take pretrials as a part of services that can be offered. Again, you want to keep in mind these people are innocent until proven guilty, so we don't want to load them up with services. Any questions?
Questions? Bernice?
I have like 5, but as I was typing, I think you answered some of them.
Okay.
So forgive me. You mentioned in terms of who gets assessed, did I hear you right? It seems like everyone who gets arrested gets assessed. Is that correct?
Yes, so the only ones that we would not assess or not eligible for assessment would be the murder or treason. All others pretty much get assessed. If we get there in the morning, they're in padded cell, we do what's called a check back, meaning that we'll go back the next day. If they're at a padded cell, we will basically go ahead and interview them. The only, I would say, the jail is really good about, because they know their audience pretty well, if they feel like somebody is a danger for us to be in a room to assess, or that they're just not at a place for us to be able to assess them and we can do it safely, we will not assess them at that time, but we will always check back to provide that opportunity if they have not had that initial hearing.
Pilot courts that have PDs in them, which made me think there were courts that don't have PDs in them.
We wanted a comparison, obviously, as being a pilot, and so we have 3 courts that volunteer to pilot utilizing the pretrial system. We have a matrix that we provide them when we send over the report. that says if this person's low risk, they're misdemeanor nonviolent, this is what we will recommend. If they're moderate risk, violent offender, and so it goes through the categories, whether they're misdemeanor, felony, as well as if they're a violent offender. Again, judge still has full discretion. It's just a recommendation based off of the risk assessment.
There's a matrix.
Everybody still gets the matrix that can be utilized. The courts that do not, that are not a pilot, those individuals do not have the public defender representation. And the public defender is one time only, just for initial hearing.
And then there's a later in assessment at their first pretrial or something. Is that it? Or-
I didn't hear the question.
So at what point then is the person assessed whether they get a public defender appointed to them at their first pretrial?
If they're a pilot court, if they fall under that pilot court, it's automatic. They will get the public defender one time for the initial hearing.
And then I'm asking, at what point are they appointed counsel for their case after that?
That's probably a question for the public defender.
Got it. Okay,
Yeah.
my bad. Very good. That's good. Thank you very much.
You're welcome.
Any other questions?
Yes, Amisha, are you able to release anyone without going to court? Based on your matrix, are you able to do an immediate release?
No.
Okay.
Great questions. Yes.
One last, just a comment. I like what you're doing because I travel around and correctional leaders we meet, this risk tools are a hot topic right now. If states haven't already adopted one, they're going to one. Just some of the stories I hear are 200 questions, 2-hour assessment. The staff hurry through it, they get rushed and they make mistakes, so that's been a problem. I like these 33 direct questions and they get down to the brass tacks. And the other issue is, some of them were complaining about, some states it seems like there's an implicit bias on the questioning. It doesn't seem like that here, so I think it's a good tool.
Thank you. I do too.
Senator Gaskell?
Thank you. At one point in your presentation, you listed maybe 8 or 10 factors that you look at in your assessment, and I got most of them down, but I wasn't quick enough. Would you mind going through
The
those?
7 items that we're looking at,
Yes.
is that what you're referring to? Okay, it's age of first arrest, number of failure to appears in the past 24 months, 3 or more jail incarcerations, employment at the time of arrest, residential stability, and that's looking at whether or not they've been in a stable residence 6 months or more, illegal substance use during the past 6 months, and severe drug use problem.
Thank you.
You're welcome.
Yes, sir.
Michelle, I have one more question. I'm uncertain on what your schedule is as far as when you're doing assessments, but is there a large percentage of people that bond before you can assess them?
On misdemeanors? Misdemeanors, I would say.
Or any?
I wouldn't know the percentage. I don't know if Pastor
So
Berkeley would know.
misdemeanors and F6, level F6 have a set bond schedule. Anything higher than that need to see a judge before a bond is set. A lot of misdemeanors and level F6 are bonding before they're being set.
Any other questions? Thank you, ma'am. How much time? We have 10 minutes.
All right. Next up is Public Defender Ken Elwood.
Thank you. Lost my notes. I would like to also echo the sheriff's comments about Tammy O'Neill. I will tell you that she has been the cog and the driver of this bus. I remember when she asked me initially to be a part of this EBDM,
She said I would be involved for about a year and I would be meeting once a month. I think that was about 4 years ago, Tammy. Public defender and their role. I am on the EBDM committee and the pretrial release committee. I had some fears when this first started, and I'll share those with you. I mean, in my world, I care about caseload and budget. So one, how are we going to pay for the public defender to cover these hearings? And two, if they're being appointed for these hearings, are the judges then going to just continue that representation? And so we have them sign a form where it's clear that we're only there for that hearing and not for future representation. And then an initial hearing down the road, the assessment is made of whether they qualify. The other fear I had is, I still have it, the substance abuse world, the more information, the better. In the criminal defense world, the less information, the better. They're still charged with a crime, and they have constitutional rights. And I can assure you, as competent as our prosecutor staff is, they are taking notes during those IRAS hearings for future plea negotiations. And so that's a concern that I've expressed throughout this process. I think the process is working, but I'm continuing to monitor that because I have concerns. Excuse me. I would also echo the jail population numbers. I think it is direct evidence that this process is working. They're being assessed promptly. My public defenders are going to the jail in coordination with a particular court. So one court does their hearings from the weekend at 11 a.m. on Mondays. So my contracted employee is going to the jail, meeting with the client separately, receiving the IRAS, and then participating in the hearing with the judge and the prosecutor. The other three courts are actually not in the pretrial process as of yet. They will as of January 1st, 2020, because of Rule 26. They are, in fact, receiving the IRAS, but they're not formally conducting the pretrial release process. And so with that, are there any questions?
Thanks, sir.
Thank you. My able adversary, Gary Gurman, prosecutor.
Good afternoon. My name is Gary Gurman, and I feel very fortunate to be the prosecuting attorney in Porter County, especially at what I consider to be historic times. When I graduated from law school, I started in the prosecutor's office, and then I ended a term in 1982, and then for the last 37 years, before January, I was a criminal defense lawyer. So I have a kind of a unique view of kind of what we're doing and what my philosophy is about the way in which our office approaches nonviolent offenders. And I really want to distinguish for you how we treat violent offenders from nonviolent offenders. That's a huge difference for me. And it is a complex issue, as we've talked about before, because I have an obligation to protect about 175 to 180,000 people. It's an obligation that I consider to be very important and very serious. At the same time, when we're dealing with nonviolent offenders, these are people who I think we can actually help. Tomorrow morning, I will be speaking at a chemical dependency program graduation at the Porter County Jail. As I tell them, it seems a little counterintuitive, doesn't it, to have a prosecuting attorney speak at the Porter County Jail to a group of graduates. But I will tell you what I will tell them, and that is this: we want to help them. I want to do what I can to make sure that they don't get in trouble again. And it is a very complex, but it is a very important issue that we, as I said, we take it very seriously. One of the things that we're doing, as you've heard, is our pretrial release program. For me, it is a chance to actually do some reconstructive work, if you will, right at the very beginning. Because I'm a very strong proponent of release from a Porter County Jail for the nonviolent offenders. I want to give them a chance, but most often I will insist on pretrial release conditions. That could be drug testing, that could be programs, that could be an anger management program, that could be any number of things. And just reporting to see a probation officer to keep track of them. I will tell you that when I'm at the chemical dependency graduation programs and I see people who have been in jail for 60 to 90 days, you would be amazed. These people are smart. They're very genuine, and they have been returned to their human being status, as I say. It is just amazing to see, and I want to be a part of that. One of my questions was, what benefit do I see coming from the pretrial pilot program? Well, one of the detriments is that we have to take a look at every one of these cases individually. That's really the benefit. That's very important to me, and our whole staff does that. We want to look at every individual case on an individual basis and make decisions. A policy, that word to me is a four-letter word. We don't have blanket and black and white rules in our office. We deal with these people on an individual basis, which I think is extremely important. Once their case has been concluded, as Ken said, Tammy O'Neill and our PAC program has done an amazing job because we have all kinds of sentencing alternatives, including our problem-solving courts, drug court, veterans court, and restoration court. By statute, I'm the gatekeeper. If I don't agree to the problem-solving courts, it's not available to a sentencing judge. But I trust Tammy, I trust PACT, and that's why we're heavily involved in those programs. But PACT does so much more in the restoration part of what we're doing in Porter County. If these people are returned to where they should be, that's a direct impact on overcrowding because they're not getting in any trouble again. It saves me money because I don't have another case. It saves the public defender money. It's a huge savings. So my philosophy is to start right at the very beginning with the pretrial release programs and end with sentencing alternatives that will continue what I hope has already been started to restore these people to who they were before, maybe before the addiction problems, before all kinds of issues that have arisen in their lives, so that they return and take their rightful place in the world. Thank you. Questions?
Any questions? Yes.
You mentioned for low-risk offenders that you like to have conditions on pretrial release for them. If you wouldn't mind sharing the why. I mean, I've read a lot of studies that say for low-risk people, loading them with conditions can actually be harmful. And then just a follow-up question, and I understand that you don't have like that it's individualized. So if you have someone who is medium to high risk, what is a likely pretrial situation for them in terms of their release?
To deal with a low risk, some low risk people are just a matter of releasing them. What I'm talking about are some of the people who are kind of in the, I'm not quite sure about the extent of their addiction issues. It could be alcohol as opposed to heroin. Heroin to me is a high risk problem. So if I'm dealing with somebody who is maybe in for a theft case, low level misdemeanor, or a level 6 felony, that could be a heroin problem, and in many cases is. I made that mistake as a lawyer when I encouraged parents to bond someone out, and he overdosed a couple weeks later. That was bad lawyering, as I found out. So I'm very careful in those, and I guess it's how we define what is medium and high risk. Some are a danger to others, and some are a danger to themselves, and that's where I think we come in with hopefully better judgment.
Thank you. Thank you, sir.
Thank you, sir.
I think that exhausts our time for presentation from Porter County. Thank you very much. We have less than 11 minutes or 12 minutes, depending on whose watch is right and whose clock is right, to conclude today's proceeding. We have, looks like 4 people signed up. We're going to at least get to 2 of them, and obviously you can participate online. We have some concluding comments, and I want to make sure I was given one charge, and that is that the task force walks out at 4 p.m. So I'm not the only one here. So if you please come forward, you have 3 minutes. Mary Kay's our official timer, and then she looks at me and I have to be mean. Invite Steve Luce, Indiana Sheriff's Association. I don't think we've heard from you and officially. So the floor is yours, sir.
Thank you, and I'll just have some just general comments. And I just wanted to come back up here again before we all leave and from my prior presentation is one of the things that the Indiana Sheriff's Association really feels to need as a solution for really monitoring and seeing the trends involved with jail overcrowding is really look into what we're going to try and do with this jail data project. And to see that as a way to drive really good solutions, put resources where they need to be, identify the trends that might be happening in different counties, because one of the things I know Sheriff Reynolds was talking about, and I totally agree with this, is not every county is the same. You could be right next to each other and have a solution. That county next door, it could be totally different. It may not work. So when you're coming up with the solutions that we are bringing out to you from your task force, is really keep that in mind too, that know the areas where you're going to be putting solutions to, because every county has somewhat to be different too in how they operate. Services. I really think we've heard a lot about services, especially in Porter County. And one of the things I learned in a recent trip to Philadelphia Bureau of Prisons and Advanced Correctional Care talked about this, was that continuation of services when they're coming out of jail is really developing those community partnerships to make sure those offenders are going to the places and seeing the people they need to do. It's very important so they don't violate their terms. And to just sum everything up from an old high school wrestling coach, and I use this analogy a lot. To me, we've been in 1006, and I've been part of it too, is I just ask everybody on this panel to really keep an open mind, because, you know, I consider, I'm going to put Justice David as the head coach right now, and everybody in here are assistant coaches. And we are truly at a halftime almost 6 years later. A good coach will go in at halftime and make adjustments. So when you come out, you win that ball game. That's the easiest way I can tell you how I really truly feel about 1006 and where we're at. We've done some great things, but we have to all be willing to make adjustments to make sure that it's that generational problem that the representative talked about, because when you look at a jail population age 34, they're married, single, divorced, and they have children. So we have to think beyond and make those adjustments for the future too. That's all I have to say. Thank you.
Thank you. I look at the people on this stage, and I'm not sure I would be qualified to be their water boy, but appreciate that. Mark Van Allen, DLR Group. Mr. Van Allen. Welcome.
Well, I'll tell you, following Porter County is quite a chore, so you can see my notes have been scribbled quite through, so I'm going to try and be as brief as possible. Committee members, Justice David, thank you. My name is Mark Van Allen. I'm Principal and National Design Leader for Justice and Civic with DLR Group. I'm also a Hoosier and a Ball State graduate. DLR Group is a national practice of architects and engineers. We have over 1,300 employees scattered across 30 offices, to include Chicago and Cleveland. We're currently providing services in Indiana to communities in Vanderburgh and Gibson counties. DLR Group has been ranked #1 in the architecture firm by Architect Magazine, #2 government design firm by BD World Architecture, and #3 justice design firm by Engineering News Record. DLR Group has gone through, and we have developed what we consider to be our design ethos, and I'll read that to you. As stewards of the public built environment, DLR Group's Justice and Civic Studio elevates behavioral, environmental, and social betterment, resulting in healing, equity, and transformation for the individual and the community. Basically, we want to participate in any discussion that breaks the closed loop of the criminal justice system, allowing individuals an opportunity to end the cycles of crime, incarceration, and recidivism, which is why we're here today. Our ethos reflects trends that are occurring across the country that are placing an emphasis on using the least restrictive approaches to sanction. We've heard some great presentation today about what some of the potential diversion programs are that are available in the world today as best practices. And we would say that only after consideration of what can be done should we begin to focus on facility solutions. So what should the state of Indiana be expecting from your architects going forward? If you do determine that you need facilities, as the sheriff indicated, that there may need to be new facilities, we need to look at considering creating environments that result in positive behavior and change, We want these environments to incorporate national best practices that relate to human dignity and environmental design. I think our mental health professionals will tell you placing a mentally incapacitated individual in a 7x10 room, locking them up for 23 hours a day is no way to treat mental health issues. DLR Group, as an organization, has been hired by Cuyahoga County and Metropolitan Cleveland to prepare a study of potential bed reductions based upon all of the thoughts that you've already heard presented today. We're currently working also with Lucas County, which is Metropolitan Toledo, in a diversion facility for that community. Lucas County has been through their own development of diversion programs. They've developed 6 diversion programs. And through the implementation of that, they've seen their average daily population drop from a high of 438 individuals in 2016 to 222 individuals in 2019. So I'm going to conclude my remarks. I stand before you as a partner and principal with DLR Group and offer to you, the committee, any assistance that we can provide you in the preparation of your report. Thank you.
Any questions? Thank you very much.
Thank you.
Unfortunately, this will conclude the time we have available for public comments. Tremendous presentations and public comments. We're going to ask Mr. Ralph Watson, Indiana Association of Community Corrections Act Counties, to give us closing remarks.
I want to thank everyone for being here today. I also want to thank Sheriff Reynolds and his wonderful staff for hosting us this morning. It was quite enlightening and very impressive. I have a lot to be proud of. County government and local sheriffs around the state are encountering a multitude of challenges that not only result in overcrowding at county jails, but also are a result of the said overcrowding. There's both ends there. It's our hope here that through the process, we not only identify some of the challenges, but identify some of the possible solutions that are working at the local level. I think Sheriff Reynolds attested to that, and I think we've heard that with the program in Dearborn County and some of the things that Porter County are doing. Very impressive. As the director of a local community corrections program for many years, it's been my experience that criminal justice challenges vary by local jurisdiction, and successful solutions are going to vary as well. One of the beauties of the Community Corrections Act is it recognizes those differences and is designed so that counties can develop solutions that best work for the local entity. And Don, I thank you for, in the development of some of that language early on, putting that in there where there was the ability for counties to adopt something that would best meet their needs. It was apparent to myself that the solutions had to take into account the entire community and the entire local criminal justice system, and a collaboration among all stakeholders was necessary in order for the possible solutions to be successful. I think it's likely that this approach is going to be necessary to effectively address jail overcrowding. Sheriffs cannot overcome the challenges alone. It's going to require work among many stakeholders. I believe that an example here was Porter County and how they've brought so many stakeholders together to try and help address a problem that is challenging a lot of counties, all counties, I should say, in the state of Indiana. And I know that we got a great deal of work ahead of us, but hopefully the work of the task force is going to help others identify a path that'll work for their local jurisdiction. I'm a firm believer that everyone's challenge is different, and the solutions are going to be different depending upon the county. And we have started, through this task force, we've really identified some programs that are worth mentioning that others might not know about. And I hope we can continue to do that as we hear further testimony.
Mr. Watson, just like to publicly say I love my sheriff, but I would never want to be a sheriff. You have an incredible challenge, but incredible opportunities also. Thank you for hosting us to Ivy Tech. Our next public meeting will be in Central Indiana at Anderson University on November 6th at, I believe, noon. Thanks to Jenny Kidwell, Jenny Bauer, Michelle Goodman, and Mary Kay Hudson from Indian Office of Court Services. They put this together, they make this work, and we appreciate all that you have done. Sheriff Reynolds and Jail Commander Stephen Lawrence, outstanding again. Thank you for everything that you do. Sir, our thoughts and prayers are to you and your family in these very difficult times. And for you to be here and take this time is just amazing. And thanks to Ivy Tech again. And we'll conclude by saying Porter County rocks. Thank you all very much.